Welcome back, everyone. In the previous lecture, we learned about the factors that influence enzyme activity: substrate and enzyme concentration, temperature, pH, activators, and inhibitors. Today, we complete our discussion by exploring two crucial topics: Isoenzymes and the clinical significance of enzymes in medicine. Have you ever wondered how doctors identify heart attacks, liver disease, pancreatitis, or muscle injury from a blood test? The answer is specific enzymes. By the end of this lecture, you will understand how enzymes are powerful diagnostic tools in clinical medicine and how isoenzymes help pinpoint organ sources. Let us first understand the concept of isoenzymes. The word isoenzyme literally means different forms of the same enzyme. Isoenzymes share catalytic functions, but differ in amino acid sequence, kinetics, and tissue distribution, allowing organ-specific identification in blood tests. Chapter: Isoenzymes. Isoenzymes arise from different genes or alternative splicing, producing enzyme variants adapted to tissue-specific roles. They often have distinct kinetic properties and regulatory features, so identical chemical reactions can be tuned differently across organs. Examples include creatine kinase Isoenzymes, lactate dehydrogenase variants, and alkaline phosphatase isoforms. We will show labeled animations comparing isoenzyme structures and highlighting organ-specific expression patterns for clear visual understanding. Understanding these distributions is essential when interpreting lab results and determining which tissue released enzymes into the bloodstream. Now let's examine specific isoenzyme systems, starting with creatine kinase and its three isoforms CKMM, CKMB, and CKBB. CKMM predominates in skeletal muscle, CKMB is enriched in cardiac muscle, and CKBB is found mainly in brain tissue. Lactate dehydrogenase has 5 isoenzymes with distinct patterns used to suggest heart, liver, or muscle involvement depending on which bands rise. Alkaline phosphatase exists as tissue-specific isoforms in liver, bone, and placenta, aiding differentiation between hepatic and bone disease. Pancreatic enzymes like Amylase and Lipase are organ-specific markers that typically rise in pancreatitis and help confirm diagnosis. Liver enzymes AST and ALT indicate hepatocellular injury. Relative levels and ratios such as AST to ALT provide additional diagnostic clues. Chapter: Clinical significance. In acute myocardial infarction, CKMB and cardiac troponins rise. CKMB isoenzyme helps confirm timing and extent of cardiac muscle injury. A typical lab profile shows CKMB rising within hours, peaking at about 24 hours, then declining, useful for monitoring reperfusion or reinfarction. For liver disease, elevations in ALT and AST suggest hepatocellular damage. Very high ALT often points to acute liver injury from toxins or infection. Amylase and lipase elevations, especially dominant lipase rise, strongly support a diagnosis of acute pancreatitis alongside clinical findings and imaging. Elevated creatine kinase with predominant CKMM indicates skeletal muscle injury from trauma, exertion, or inflammatory myopathy rather than cardiac origin. Case 1. A patient with chest pain, elevated CKMB and troponin points to myocardial infarction and requires immediate cardiology intervention. Case 2. Abdominal pain with markedly elevated lipase and amylase supports pancreatitis. Clinical management includes hydration, pain control, and imaging follow-up. Case 3. Jaundice and predominant ALT elevation with abnormal liver panel suggest viral hepatitis or toxin-mediated injury requiring targeted testing and care. These examples show how isoenzymes and organ-specific markers transform biochemical numbers into precise clinical decisions for diagnosis and monitoring. Key takeaways: isoenzymes are variants of the same enzyme, tissue distribution matters, and patterns of enzyme rise and ratios guide diagnosis and timing. Thank you for watching. Review the labeled diagrams, practice interpreting lab patterns, and join the next lecture to continue